things that came out of the Holland Town Hall is we were talking about there's a bigger gap between those of us that have no ACEs and those of us in our community that have 4 or more ACEs. In Ottawa County, we have a bigger gap there. But the next day, I was presenting to a group of volunteers and talking about this, and they said, we might have a bigger gap, but that just means that there's more of us that can help. There's more of us that can step up to mitigate the adverse childhood experiences. And I just like to share that because I just think that that's really powerful. We talk about that bigger gap between our community that has 0 ACEs and our community that has 4 or more, but that just means that there's more of us that aren't experiencing trauma that can support those that are. And we know that supportive relationships are one of the most important ways we can mitigate ACEs. We also do want to look at this across populations, and really what we find is it is consistent across populations. It really does not matter, the demographic breakdowns. And all of this data comes from the Ottawa County Behavior Risk Factor Survey. So this is Ottawa County data. We also know the impact of ACEs. That what this slide is showing you is really the higher the number of your ACEs, the more likely you are to experience obesity, chronic pain, disability, to be a smoker, to experience depression, and also a suicide attempt. The suicide, having attempted suicide is probably one of the most startling statistics. 50% of those who have 4 or more ACEs have attempted suicide, compared to 0% who have 0 ACEs. And so when you talk about mental illness, the impact of the ACEs is really important. ACEs also impacts lifespan by about 20 years. You can't see the bottom, but it says 60 years is the average life expectancy if you have 4 or more ACEs. It impacts your economic success. And we know that ACEs are common, and they are largely unrecognized, although that is changing, and you are all here today to learn more about the ACEs. They're strong predictors of mental illness, health risks, disease. They're interrelated, they're not solitary, and they're the leading determinant of health, social, and economic outcomes in our nation. They are 5 out of the 10 are related to child abuse and neglect. And we know that that disproportionately impacts children under 5. I'm running out of time, so these are all the possible risk outcomes that can happen, but we do know that we can prevent, mitigate, and treat ACEs, that we can build resilience in our community, and that resilience really is the key. And that ACEs aren't the end of the story. And with that, I'll turn it over to Jody.
Great. Thank you. We'll do questions for everybody at the end. Thank you.
Awesome. Thank you so much. So that was a great introduction to adverse childhood experiences in a very short amount of time. So congrats. My name is Jody Spicer, and I work at the Michigan Department of Health and Human Services, so my office is in Lansing, and I am the Adverse Childhood Experiences Consultant for the public health side, and my office is the Division of Chronic Disease and Injury Control. So I've been in that role for about 2.5 years, and I have the opportunity to...
Could you put that last slide back up with that quote, since you're just...
Sure. Given that opportunity as the ACE consultant, I get to do things like this. I also am from Grand Haven originally, born at North Ottawa, lived in Grand Haven, and have family here, so it was a great opportunity to sort of come home this afternoon, so appreciate being here. So I am here to talk a little bit about what's happening at the state level and sort of how, as a system, we're trying to respond to ACEs. So I did kind of fly in just before 6:30, and I do have a handout that kind of is an overview of what Lee shared and what I'm going to share that's on the table over there without the tablecloth, so on the left-hand side. So at the break, feel free to grab one of these. I'm also happy to send it electronically. One of the things that I'm trying to do is create awareness and spread awareness about the topic, and so I find that this one-pager is one way of doing that. So in Michigan, I feel like we're very solidly in this awareness building phase. When I go around the state and do presentations, I would say that most of the time, less than half of the room knows anything about ACEs. Whether I'm talking to professionals, parents, it doesn't matter what part of the state. So there's still this need to understand a little bit more about it, and I'm thrilled to be in a room full of people who are here. So we already know that ACEs was this landmark study done in the early 90s by Dr. Vince Folletti and Dr. Rob Anda. We already know that these are the 10 unique ACEs that they found to have predictive factors to negative health outcomes. The important thing to note about this study is that it didn't look at any one kind of adversity or trauma. As Lee said, it looked at the load or the number. So it's that combination of experiences, and that was one of the things that was really unique about the study. Rather than focusing on any one adverse experience, it was kind of looking at that intersection or that load that happens. And the original study, of course, showed that the ACEs were common. What we did, and what that means is that 2/3 of people have at least one ACE, and that was done in Southern California in between 95 and 97, and that was as Lee said, all those folks were associated with an HMO, so they were relatively middle class, well educated. The average age was 57. And frankly, Drs. Folletti and Anda were not really sure what they were going to find, and were quite surprised that they found that there was this correlation to these negative health outcomes and that the prevalence was so high. So in Michigan, we began our ACEs exploration in 2013, and then in 2016, just like locally, there's a behavioral risk factor surveillance survey. That's a mouthful, so I'm going to call it the BRFIS, which sounds silly, but that's what I call it. So locally there's a BRFIS done, but then there's also one done statewide. And so in 2016, we added the ACE questions to the Michigan BRFIS, and we have state level data. So we asked it of about 3,000 people, which was 1/3 of the total sample. So we can't drill down to county level. You're lucky in Ottawa that you have county level data, but we can't drill down this data to county level because we don't have enough of the data available. But the BRFS does both landline and cell phone, and as I said, the ACEs questions were asked of about 3,000 people. The one thing to note about the BRFS is that it's really only looking at 8 of the 10 ACEs. The 2 neglect ACEs are not reflected in any of the BRFS data that you see, mostly because there are far too many questions to ask that would get at those 2 ACEs. So you can't just ask, have you been emotionally neglected, yes or no? There are too many questions that were asked in the original study to get at that, and it didn't pass the rigorous testing process that the CDC has. So whenever you look at the BRFS data, it's out of 8 of the ACEs rather than 10, which doesn't really change the story. It's kind of just a data nuance that sort of we just need to acknowledge. So this is kind of hard to see, but we are making this available in a more easily readable format, but it's similar to what Lee shared. And you can see that in Michigan, we have the highest prevalence of adults who reported being verbally abused as children. So the other thing to know about the BRFS is it's asked of adults, and they're asked to think about their childhood. So reflecting back on before the age of 18, and then a variety of questions are asked. Did you experience this, or is this what you had in your family? And you can see that verbal abuse was the highest, but that there are 8 of them listed here that showed some kind of prevalence in Michigan. In general, this is the ACEs data as far as prevalence across the board, and you can see that 34.1% of Michigan adults reported 0 ACEs, which means that 76 reported 1 or more, so 2/3 had 1 or more. And in Michigan, as a state, 18.2% had 4 or more. So this means, as Lee shared, that ACEs remain common but largely unrecognized, and 66% of Michigan adults reported having at least one ACE. The important thing to note here is that's not a whole lot different than Southern California in 1995. And I think that's the part to kind of remember. Sometimes when I get up and talk about data and I talk about 2016, that seems like a really long time ago. And so it feels like, what does that mean for today? And I think the take-home message is the data hasn't really changed yet. We haven't really kind of moved that needle. So the orange table here is from the original data, which was published in 1998, and the blue is from 2016, and they're really quite similar. And so the data hasn't really changed. As Lee said, if they rarely occur in isolation, if you have one ACE, 87% of the time you're likely to have another, and 50% of the time you're likely to have a third or more. And what we know then, and the reason I'm here sitting, and the reason I'm part of the Department of Health and Human Services, is ACEs have lasting effects on our health, on our behaviors, and ultimately on our life potential. So all of my colleagues in the Division of Chronic Disease and Injury Control are working on things like obesity and diabetes and suicide prevention and heart disease, and these are all related to adversity in childhood. So here is the next two graphs I'm going to show you are looking at data from Michigan, and this first graph is looking at a set of health outcomes. So the blue bar are those adults reporting 0 ACEs, and the red bar are adults reporting 4 or more, and there's 5 sets of bars. So on the far left, that's looking at more than half of last month having activity limitation days. The second set of bars is reporting fair or poor health. The second set of bars are those reporting more than half of last month having poor mental health days. The third set of bars are those reporting more than half of last month having poor physical health days. The fourth set of bars are those reported to be diagnosed with a depressive disorder. So not just feeling depressed, but having someone tell you that you have a depressive disorder. And then that last set of bars are those reporting fair or poor health. And you can see that dose response that Lee talked about. So the higher the ACE score, the higher the likelihood of that negative health outcome. And then this, the second chart is looking at risk behaviors. Same thing, blue bar is 0 ACEs, red bar is 4 or more. And this is looking at things like binge drinking, reporting as a current smoker, having no healthcare provider, having no time for physical activity, or having no routine checkup in the past year. Some of them have more of a dose response than others, but for the most part, the higher the ACEs, the higher the likelihood of experiencing or having one of those health risk behaviors. The good news is that while this data is sobering and really compelling, it's served as a catalyst and a connector at the state level. So there are lots of folks who are becoming interested in this, and that's reflected not only in community conversations like this, but at state office buildings as well. Because once we start thinking about ACEs and begin to acknowledge and recognize them, it changes the way we think then. So rather than thinking about somebody and wondering what's wrong with you, or why do you keep smoking when you know it's bad,